Hello, welcome back. I am here today with my own personal chiropractor, Dr. Sydney, and a colleague of mine. And we are going to be talking about the intersection between spinal health and our mental health. And it's an intersection that I think is important to talk about, but I don't see or hear it kind of talked about out there. I'm not sure about you, Dr. Sydney, but I'm excited to have this conversation. So thanks for joining.
Yeah, thanks for asking me to be here. I'm really excited because I do find that I have these conversations in my office, but I would love to see and grateful that you're creating opportunity for us to have this conversation outside of just one-to-one patient interactions. So thank you for having me here today.
Oh, absolutely. And yeah, the mind and body are connected, obviously,
For sure.
and we can't talk about them in isolation. So I think that's what we're going to bring up in this conversation today.
Definitely.
So we've had a lot of time together on the adjustment table, me being on the adjustment table, and we've talked about our work and how we share some common themes and perspectives and philosophies in how we support our clients and patients for you. And so I want to talk about those four themes today from my perspective as a behavioral food therapist, and then from your perspective. So before we get into those four themes, I would love for you to just introduce yourself and what you do and share more about your approach.
Yeah, thank you. So my name is Dr. Sydne Pomin. I have my own private practice in San Rafael, California. It's called Thrivia Chiropractic and Natural Health. And really my overarching goal when I work with people and I work with their bodies is I really believe that our bodies are a vehicle to experiencing more joy in our lives. So I like to work with my patients and really figure out what creates joy for them, and creating a partnership, which I think we'll talk about today, and a team together to really help people feel empowered in their bodies.
I love that. I love that. So I look forward to talking about that partnership piece and just how we can use our body as a vehicle for
Absolutely.
experiencing more joy. And just as a quick background introduction for anyone who doesn't know me as well, my name is Katie Schmidt. I'm a behavioral food therapist, and I help my clients with the emotional health aspect of how they're relating to and wanting to heal their relationship to food, their body, and themselves. And we will work to overcome things like emotional eating, the binge restrict cycle, body image issues, diet mentality, and then also just working to find ways to live a more thoughtful and intentional life. And so the four themes that we're going to get into today, just as an overview, first of all, are the value of partnership, like you already mentioned, attunement, and really paying attention to ourselves and our body and our thoughts and emotions. Also, the third one is our nervous system and how our posture affects our nervous system. And then the fourth theme is taking a trauma-sensitive approach to supporting our clients and patients.
Absolutely.
Okay, so let's start with the first theme that we have in common. Of course, we approach it from different angles. The value of partnership. There's a lot that can be said about this, but I really value being a partner to my clients, and I value having partners in my own life and in my care.
Absolutely.
And I feel like we can't support our clients or patients if they're not willing to come halfway and meet us halfway and do their own work as well. But when they do, and they are willing, then we truly, I believe, we heal in safe connection with others. We heal in safe relationships. And so I see my role in partnering with my clients as one of helping them have compassionate inquiry and having that curiosity and awareness to check in with themselves and be in this safe space and have a conversation around what's going on, how am I feeling, what's not working, what do I want to shift. And we so often turn to food to get non-food needs met. And there's that automatic kind of response and disconnection from our body. And I think sometimes there's a physical component to disconnecting. And I'm curious your thoughts, because we can sometimes have pain in our body that we don't want to feel. and we can feel uncomfortable. We may not feel safe in our body or our present situation, so we disconnect. And so I'm curious how partnership shows up in your work with patients, and why it's important that patients value that partnership in working to feel more safe and comfortable in their body.
Yeah, absolutely. Yeah, I love that we're starting off from that place, because I think you and I working together, we very early on, I established like, you and I are going to be a team here. Like, I think a lot of times, especially in our culture, we have this hierarchy of, I have the label of a doctor, and that means that there's a hierarchy here. And I realized that I want to work and walk a path with my patients, helping guide them, and really identifying with the if you go and interpret the word doctor in Latin, it actually means teacher. And so that's been the foundation of how I view a lot of my work is, I want to be with you and teach you more about your body. Because as I said, I feel that once you have an empowered relationship with your body, you get to make empowered decisions about your health, right? And so my care is, we definitely have, physical manual adjustments in my office, but I also like to give my patients tools to use outside of the office, because an adjustment can only go so far if you don't have the tools to know how to support your body outside of being in my office. And so that's the partnership walk that I visualize, right? Is, we do an adjustment, I give you some tools, we check in, you come back for your next visit, we check in how things are going. What is reasonable and applicable in your life? Are these sustainable? Because sustainability in our health, I think, is a huge part of it. Like, I can give you 43 exercises to do, and you might do those for a day or two, but realizing that's not sustainable, right? So how can we create more of a sustainable healthcare model that you walk with me, that we are walking together, versus you're just seeing me for a passive treatment? And also, to talk about that point you just made around pain, is I encourage my patients to look and understand that pain is a signal from the nervous system, right? Pain is a signal of safety, really. Does the brain feel safe right now? Because a lot of the times the body will uptick pain because the body's mobility or its perception of the environment doesn't feel safe. And a pain signal will kind of keep you locked in. You're not going to all of a sudden sprint if your low back is hurting, right? So that's another part of the partnership piece, is really helping to have a different conversation of what is happening to my body. So I'm not rewiring that relationship of, oh, I'm in pain, I'm going to take Advil, or I'm going to have an outside seeking activity. Like, oh, this is really, I feel really uncomfortable right now, I'm going to do something to disassociate or minimize it, versus, like you said, getting curious, like, why does my back hurt right now? What did I do a day ago? What activities could have aggravated this today? Does my body feel safe right now? Do I have tools to check in with my body to feel that I'm safe right now? So all of that is being encompassed in how I view my partnership with my patients.
Yeah. Yeah. And I love that you create that safe space where hopefully they feel comfortable coming to you and having those conversations, because I think there can be a lot of shame around how we feel, what we do, what our behaviors are. And we don't see, as it exists today, this healthcare model, we don't see our doctors as partners who we can speak to on the same kind of playing field, or whoever we're working with as a partner. So what would one thing be that your patients could do to ensure that they are in partnership with you and able to get the most out of their adjustments and their work with you?
I think first and foremost is getting curious, right? And I really love the perspective shift of curiosity versus bad or good. A lot of the times somebody will be like, I was bad. And I'm like, oh, like the weight of just that statement of like, I was bad. I'm like, you weren't bad, like get curious as to why, you sat on the couch for 3 hours and watched Netflix rather than get up and move your body around to get some motion and mobility. So I really think it is that getting curious piece.
Yes.
And then I always encourage people, I'm like, ask questions. Like with that curiosity, you should be getting more questions. And so I always like to leave time and space for us to answer questions, right?
Mhm.
And I find women especially have this, well, I don't want to bother you, and I feel like I've got set time and I schedule myself in such a way that we have time for that, because I think that that's important. Because again, I don't view my treatment as passive. I view it as very active, meaning I want my patients to walk away after each adjustment with like a new insight, with a new understanding, with a new, perspective of how to view their body and themselves. So I think it's being, making sure that they feel, it's my role that I want to make sure that we have that safe space to do it. And also for them to know that there's permission for that right now. Like let's get this figured out, because
Mhm.
I think I said to you, is like, I'm not a Band-Aid chiropractor. I don't want you coming to me every single week because you have the same pain. Like that, I become a very expensive Advil, which is just it's not interesting to me, right? Like, I want you to have an understanding. It's like, I want to get you out of pain. And I know chiropractic is so powerful with that. But then I want you to have tools and an understanding of why you were in pain in the first place, what is actually happening in your body. Because I think a lot of times pain can feel so disconnecting and so scary, right? Like pain can be very scary. And so to reestablish a different relationship with that.
Yeah. I love what you said, giving them permission. And for women, especially, the value of partnership, in addition to what we've talked about, I feel like, is modeling permission giving.
Mm-hmm. Yeah, that's beautiful.
Giving our clients and patients that permission to take up space.
Yeah.
And to own their needs.
Right. Yeah, absolutely. And I think that it's like the concept of sovereignty, right? Like you belong to you, I belong to me, and we can be interconnected with one another, having that understanding, right? There's no you don't need to worry about me, and I need to trust that you'll come to me with what you need, right? And creating a space for that, which there's not always space for that in healthcare. And I think that that's an important thing to label and acknowledge.
Right. And there's not always that space in relationships in general. So
Mm-hmm.
learning through these safe partnerships how to have an interdependent relationship where we also have a sense of self within that relationship.
100%. Yep.
So I think that we're both hopefully modeling that for our clients to have that sense of self and come forward.
Yeah, absolutely.